Methamphetamine. Methamphetamine is a highly potent synthetic stimulant that powerfully affects the central nervous system and dramatically alters brain chemistry. It triggers an intense and rapid release of dopamine, the neurotransmitter responsible for pleasure, motivation, and reward. This dopamine surge produces extreme euphoria, heightened confidence, and a powerful sense of energy that can last for many hours. Users often feel unusually focused, talkative, and physically restless during the experience. One of its strongest physical effects is appetite suppression, which can lead to significant weight loss over time. Sleep deprivation is also common, as individuals may stay awake for extended periods while under its influence. Methamphetamine significantly increases heart rate, blood pressure, and body temperature, placing major strain on the cardiovascular system. Because of how strongly it activates the brain's reward pathways, it carries a very high risk of addiction. Long-term use is associated with paranoia, hallucinations, mood instability, and aggressive behavior. Chronic users frequently experience severe dental decay and skin lesions due to both physiological and behavioral factors. Brain imaging studies show long-lasting damage to areas involved in memory, emotion, and impulse control. In cases of overdose, methamphetamine can cause stroke, heart attack, organ failure, or death due to extreme physiological stress. Psilocybin. Psilocybin is a naturally occurring psychedelic compound found in certain species of mushrooms. Once ingested, the body converts psilocybin into psilocin, which primarily affects serotonin receptors in the brain. This interaction leads to profound changes in perception, cognition, and emotional processing. Users often report intensified colors, enhanced sounds, and visual distortions such as patterns or shifting imagery. A distorted sense of time is common, making moments feel unusually long or short. Emotional states may become deeply amplified, ranging from intense joy to challenging introspection. Many individuals describe spiritual or mystical experiences that feel personally meaningful. Effects typically begin within 30 to 60 minutes after consumption. The psychedelic experience generally lasts 4 to 6 hours depending on dose and environment. Psilocybin is not considered physically addictive and does not cause chemical dependence. However, anxiety or panic can occur during difficult experiences, especially in unsafe settings. Ongoing research is exploring its potential therapeutic role in treating depression, anxiety, and trauma-related disorders. Alcohol. Alcohol is a depressant substance that slows down activity in the central nervous system. It primarily works by enhancing the effects of GABA, an inhibitory neurotransmitter that promotes relaxation. At low doses, alcohol can reduce anxiety and increase sociability. As consumption increases, coordination, judgment, and balance become impaired. Speech may become slurred and reaction times noticeably slower. Memory blackouts can occur when alcohol interferes with the brain's ability to form new memories. High levels of consumption can lead to alcohol poisoning, which suppresses breathing and consciousness. Long-term heavy drinking damages the liver, often leading to fatty liver disease or cirrhosis. Alcohol use also increases the risk of heart disease, stroke, and several cancers. Dependence can develop gradually, making it difficult to control intake. Withdrawal symptoms can include tremors, hallucinations, and seizures. Despite its legal status, alcohol is a major contributor to global disease and injury. Ketamine. Ketamine is a dissociative anesthetic originally developed for medical and surgical use. It works by blocking NMDA receptors, which play a key role in glutamate signaling in the brain. At lower doses, ketamine may cause mild euphoria and a detached dreamlike feeling. At higher doses, users may experience profound dissociation from their body and environment. Some describe this state as an out-of-body experience or entering a K-hole. Ketamine often raises heart rate and blood pressure temporarily. Its psychoactive effects usually last between 30 minutes and 2 hours. Repeated recreational use can cause inflammation and damage to the bladder. Long-term misuse may impair memory and attention. In controlled clinical settings, ketamine is used to treat severe and treatment-resistant depression. It is also effective for pain management in emergency medicine. Combining ketamine with other depressants significantly increases overdose risk. Nicotine. Nicotine is a stimulant most commonly consumed through cigarettes, vaping devices, and other tobacco products. It rapidly enters the bloodstream and reaches the brain within seconds of inhalation. Nicotine stimulates dopamine release, reinforcing repeated use and addiction. Users often report improved concentration and alertness. Heart rate and blood pressure increase shortly after use. Nicotine is one of the most addictive substances due to its rapid onset and frequent dosing. Withdrawal symptoms include irritability, anxiety, and strong cravings. While nicotine itself is addictive, many health risks come from tobacco smoke toxins. Long-term smoking greatly increases the risk of lung cancer and heart disease. Nicotine replacement therapies can help reduce withdrawal symptoms. Behavioral support improves long-term quitting success. Despite widespread awareness of risks, nicotine addiction remains common worldwide. LSD is a powerful synthetic psychedelic that alters perception and consciousness. It interacts primarily with serotonin receptors in the brain. Even extremely small doses can produce intense psychological effects. Users often experience vivid visual hallucinations and geometric patterns. Thought processes may become nonlinear or deeply introspective. Emotional responses can intensify dramatically during the experience. Time perception is frequently distorted. LSD effects can last 8 to 12 hours or longer. It is not considered physically addictive. Some individuals experience anxiety or panic during overwhelming trips. Rarely, persistent perceptual changes may occur after use. Research continues into LSD's potential therapeutic applications. Opioids. Opioids are a class of drugs commonly used to treat moderate to severe pain. They work by binding to opioid receptors in the brain and nervous system. This action reduces pain perception and can produce feelings of relaxation. At higher doses, opioids can cause intense euphoria. Breathing slows as opioid levels increase in the body. High doses can suppress respiration to fatal levels. Repeated use leads to tolerance, requiring higher doses for the same effect. Physical dependence develops with continued use. Withdrawal symptoms include muscle pain, nausea, and severe discomfort. Misuse has contributed to a global overdose crisis. Medications like methadone and buprenorphine are used in treatment. When prescribed responsibly, opioids remain essential for pain care. Caffeine. Caffeine is a widely used stimulant found in coffee, tea, and energy drinks. It works by blocking adenosine receptors that promote sleepiness. This increases alertness and reduces fatigue. Effects usually begin within 15 to 45 minutes. Many people rely on caffeine for daily productivity. Moderate consumption is generally considered safe. High doses can cause jitteriness and anxiety. Heart rate and blood pressure may increase slightly. Regular use can lead to mild physical dependence. Withdrawal often causes headaches and fatigue. Caffeine rarely leads to severe addiction. Its effects typically last several hours. MDMA. MDMA is a synthetic drug with both stimulant and empathogenic effects. It causes a large release of serotonin in the brain. Dopamine and norepinephrine levels also increase. Users often feel emotional openness and empathy toward others. Sensory experiences such as touch and sound may feel enhanced. The effects typically last 4 to 6 hours. MDMA raises body temperature and heart rate. Dehydration and overheating are major risks. After use, some individuals experience low mood or fatigue. Repeated high-dose use may damage serotonin systems. MDMA is being studied for PTSD treatment. Mixing it with other substances increases health risks. Benzodiazepines. Benzodiazepines are sedative medications commonly prescribed for anxiety and insomnia. They enhance the effects of GABA, reducing brain activity. This produces calming and muscle-relaxing effects. They can quickly reduce panic symptoms. Drowsiness is a frequent side effect. Memory and coordination may be impaired. Long-term use can lead to tolerance. Physical dependence may develop over time. Sudden withdrawal can cause seizures. They are safest when used short-term under medical supervision. Combining them with alcohol increases overdose risk. Despite their benefits, misuse remains a concern. Cannabis. Cannabis contains psychoactive compounds, primarily THC. THC binds to cannabinoid receptors in the brain. Users often feel relaxed and mildly euphoric. Sensory perception may become heightened. Appetite frequently increases after use. Short-term memory can be impaired. Higher doses may cause anxiety or paranoia. Effects typically last several hours. Long-term heavy use may affect motivation and cognition. Cannabis has recognized medical uses for pain and nausea. Dependence can develop in some users. Laws regulating cannabis vary widely worldwide. Cocaine. Cocaine is a powerful stimulant derived from coca plant leaves. It blocks dopamine reuptake in the brain. This creates intense but short-lived euphoria. Energy and alertness increase rapidly. Effects often last less than 1 hour. Heart rate and blood pressure rise sharply. Repeated use increases addiction risk. Snorting cocaine can damage nasal tissues. Cardiovascular complications are common with heavy use. A crash often follows the high. Overdose may cause seizures or heart attack. Cocaine remains illegal in most countries. If you liked this video, you're going to love what's coming next. In our upcoming episode, we're debunking the biggest coffee misconceptions and separating science from myth. Make sure you subscribe and turn on notifications so you don't miss debunking coffee misconceptions.